How is latent TB diagnosed? Have you ever wondered how doctors figure out if someone has latent tuberculosis infection? It's a bit more complex than a simple test. First, let's talk about what latent tuberculosis infection, or LTBI, actually is. It means that a person has been infected with the tuberculosis bacteria, but they do not have active tuberculosis disease. This is important because while they are not sick, they can still develop active TB later on. To diagnose LTBI, healthcare providers use a combination of tests and evaluations. The first step is testing for TB infection. There are two main types of tests: the Tuberculin skin test and blood tests, known as interferon gamma releases assays. If someone gets a positive result from either test, it indicates that they have been infected with the TB bacteria. Now, the Tuberculin skin test involves injecting a small amount of tuberculin under the skin. After 48 to 72 hours, a healthcare provider checks for a reaction. If there is a raised, hardened area, it suggests that the person has been infected. Blood tests are often preferred for people who have had the BCG vaccine or for those who might not return for the skin test reading. But that's not the end of the story. A medical evaluation is crucial to rule out active TB disease. This includes taking a detailed medical history and performing a physical examination to look for any symptoms of active TB. A chest X-ray is also done to check for any lung abnormalities that might indicate active disease. In some cases, sputum samples may be collected for laboratory tests to confirm that there is no active TB. If the TB infection test is positive, but the medical evaluation shows no signs of active TB, then the diagnosis is latent TB infection. This distinction is vital because the treatment for latent TB is different from that for active TB. If active TB is suspected or confirmed, different protocols are followed. In summary, diagnosing latent TB involves a careful process of testing and evaluation. It starts with identifying immune sensitization to the TB bacteria through blood or skin tests. Then, a thorough clinical assessment is done to ensure there is no active tuberculosis disease. This careful approach helps ensure that individuals receive the right treatment and reduces the risk of developing contagious TB in the future. Always remember, if you have concerns about tuberculosis or your health, it's best to consult a healthcare professional for personalized advice.